thank you all for coming to the CARES conference today. We're all very lucky to have you as our patients and in our community. And for this topic in particular, I feel that I really need your help in answering some of these questions. I think that many of you have probably asked these questions of yourself and probably of your doctors, and I would appreciate as much participation as possible from the audience. So to start off my talk, I'm going to ask everyone to kind of stretch your arms up or maybe stand up for a moment if you can, and you'll see kind of why I'm asking you to do that. So everybody just kind of do a big stretch. Excellent. Yes, great audience participation already. Great. So you can stay standing if you'd like, or if you'd like to sit and relax, that's also probably preferable for most. So you are taking all your eye drops, and you're seeing your doctor regularly, but one of the reasons that you're here today is you're wondering, what more can I do for my glaucoma? So hopefully this is a question we can help answer today. So today we'll be discussing some glaucoma lifestyle do's and don'ts, and you all are going to help me answer some of these questions. So if I had the option tonight of watching TV or going for a walk or a jog around my neighborhood, which one do you think I should do? Great. So studies have shown that walking, jogging, running, spending more time standing, like you guys all just did, can lead to decreased loss of vision from glaucoma. The evidence is kind of mixed, and a lot of these studies are still early on, but we know that being active is going to help you health-wise all over your body, not just your eyes. So that is something that you should continue to do. Patients with severe vision loss from glaucoma are less likely to be physically active. We've seen that also in our research studies. So these patients especially need to find ways to kind of keep moving for their overall systemic health. Another option, so if I had the option of smoking or breathing clean air, which would you choose? Excellent. So the idea here is really stop smoking cigarettes, try to get enrolled in a plan, find a friend who will help you stop, because smokers have an increased risk of developing all different types of glaucoma. Heavy smoking leads to a higher risk of developing glaucoma, so even if you can cut down on the number of cigarettes you smoke a day, that could help. Next choice here would be consuming these CBD gummies for a snack versus using marijuana in the form of a joint. Which option here do you think is preferable, or is neither one preferable?
Neither.
Kind of some mixed answers, and it's difficult to tell what is best. In this scenario, really, both of them are probably a thumbs down for some various reasons. So all of the studies show that marijuana does not really help in glaucoma in a sustainable way. Marijuana can actually increase the eye pressure in about 50% of the people who use it. And its effects only last for about 2 to 3 hours. So it needs to be used 8 or 10 times a day in order to lower the eye pressure all day, and for some people it might increase the eye pressure during that time. We don't know how much active ingredient is in each serving, so you might be getting a lot, you might be getting a little bit. And of course, if smoked, it increases the risk of lung cancer, which is something that nobody wants. My next choice will be, should I get a cup of coffee or a cup of tea to drink?
Tea.
We have some takers for tea. Anyone else? So in this scenario, actually both are good. Both are fine. So coffee and tea do not have a clear negative or positive effect on glaucoma, and drinking at least 1 cup of hot tea daily might prevent glaucoma. So I guess the coffee and tea we have outside for you, both of those are fine. Next question, will drinking alcohol make my glaucoma worse? What do you guys think?
Yes. No.
So in this scenario, actually there's really no clear link between drinking alcohol and glaucoma. However, excessive drinking can lead to more sedentary activities, more unhealthy lifestyle choices, which if done chronically are going to be bad for your health. Next question, which vitamins should I take for my glaucoma? So there are a number of different nutrients that are associated with maybe a positive effect on glaucoma. Generally, these are nutrients that are good for your body all over, so you should, try to get plenty of them, like iron, which you can get from broccoli and various nuts and lentils. Mushrooms are also in this picture. Calcium, which you can get from your milk, cheese, eggs, various nuts. Ginkgo biloba has been found to have some positive effect in glaucoma. Omega-3 fatty acids, which we find in avocado, nut, fish, all of those are also helpful. However, it's very important that you check with your primary medical doctor before starting any new vitamins or medications. Next question, does diet affect glaucoma? What do you guys think?
Yes.
Yes.
So there are some foods that lower the risk of glaucoma. These include green leafy vegetables, foods with nitrates such as beets, celery, or spinach, oranges, peaches, kale, carrots, things with antioxidants like blueberries or dark chocolate. Generally, foods that you feel make you feel better and make you feel good are good for the rest of your body and good for glaucoma. If you snore, is this a problem?
Yes.
Not just socially or for, your family, but is this a problem for glaucoma?
Yes.
Maybe. So studies have found that there is a higher prevalence of glaucoma in those who snore. So you should tell your primary medical doctor that you snore at night, and you may need to undergo a sleep study to kind of see if the snoring is associated with an episode of not breathing while you're sleeping, which of course can be dangerous. So, there are a number of lifestyle changes you can make with, trying to improve your glaucoma or trying to improve your overall health. It is, however, most important that you have close medical care with us or with another eye doctor. You take your medications every day on time, you follow up with your doctor as recommended, and you have your family members screened. As you guys may know, if you have a first-degree relative with glaucoma, your chance of getting it is 10 times higher than the average person. So it is very important to get screened, to encourage your brothers, sisters, and children as well to get screened. Any questions? Yes?
For the walking, jogging, for glaucoma, is regular walking help? And how long should I walk regularly? And how many times a week? Please, thank you.
Definitely. That's a great question. So the question is does regular walking help, and how long should be walking each day, or how many times a week? So moderate aerobic exercise, which is kind of a faster walk, or whatever walk you're able to do, is helpful. If you do about 30 minutes about 5 times a week, that's considered pretty adequate in terms of how active you can be.
Good, thank you.